In 2023, Duke Health took a bold step forward by integrating the private diagnostic clinic into our health system, creating the Duke Health Integrated Practice. Today, I'm joined by Matt Barber, president of DHIP and vice dean for clinical affairs, to reflect on the progress we've made and the future of care for Duke. Matt, thanks for joining me today. So it's been about 2 years since the private diagnostic clinic, which was the faculty practice, was integrated in the health system. From your standpoint, why did that have to happen, and what are the first milestones we've hit?
Well, first of all, thank you for having me. It's really exciting to be at DHIP's 2-year anniversary. I think it really was critical for us to do this integration so that we could become the integrated academic health system that we need to be. The biggest impact really has been clinical growth. As you know, we've hired an extraordinary number of clinicians, more than 700, which has allowed us to increase the care that we provide, not just in our local community, but now outside our local community, and get into a number of partnerships and other things that are expanding the care that we provide across the state. I think another really important thing that integration allowed was reinvestment back in our faculty and in our clinicians. We're not just in terms of compensation, but benefits, but also things like a bridge, which has really been a benefit to the faculty in terms of the ambient listening and how they provide care to patients.
So growth to provide the care in a broader reach of North Carolina is a primary goal, but what are some of the other reasons to grow?
Well, I see DHIP really as the clinical engine that's driving Duke Health in all of our missions, right? It allows us to provide more care to more patients, but it also supports our research mission and our academic mission and our community health mission.
So if you're a faculty member or staff or student, what are you experiencing now that was different in the PDC?
Actually, the thing I think I'm most proud of is what people didn't experience was that the patients and the staff didn't even notice that we made the transition.
So that's good.
Care continued.
Right.
For the faculty and for the students, I think the biggest thing has been that this integration has been a catalyst for us to come together as a single integrated system, right? It's created synergies between the practice and the School of Medicine, between the practice and the health system, and really allowed us to start to see the potential of one Duke, which is something I know you've talked a lot about.
So we use this term integration. What does that mean in terms of across departments and integration with the school?
Well, I think to me, it means how do we become better together? Integrating and making synergistic all of our missions, but also more aligned strategically so that we're all rowing in the same direction, trying to achieve the same goals so that we ultimately get to the vision that we hope for Duke Health.
Now, if you're a patient, you hope that some things do change. What positive changes might a patient see?
Yeah, well, already we're increasing access, right? We're increasing access in our local community with the new providers. We're increasing it in new and different ways with digital health and other things. But now we're starting to get outside the triangle and provide care in places like Lake Norman, which we were not in before, across North Carolina with this new partnership with Novant, even down into Charlotte, which is really exciting. So
you have a split role, as do others. Why do we do that?
Well, I think it just aligns us better as an organization because we are so much better together. One of the things that's been exciting about this integration is we're breaking down silos, right? We are seeing an integration and an aligned strategy between the school and the practice and between the health system, really all of who we are into the School of Nursing now. It's really what brings us together and makes Duke Health a special place.
Right. So now you've been at Duke for how many years?
Well, I trained here in the 90s for both my residency and fellowship and then came back 8 years ago. So
what is it that you love about being at Duke?
Well, I think I have a story much like yours. I fell in love with Duke when I was here as a trainee. And there's something about the place, the culture of innovation and of collaboration, a true academic and clinical environment. But ultimately, it's about the people, right? There's something that gets in your blood. So many people stay or come back. It's just a fantastic place.
It's always about the people.
Yeah.
So Matt, thank you for all that you do, and thank you for leading the practice.
Thank you so much. This was really great.